Doctor, will you tell us at what points fractures of the femur occur and something of the classification of such fractures? Fractures of the femur are generally divided into fractures of the neck of the femur and fractures of the shaft of the femur. There are also fractures of the epiphysis, such as we described in connection with fractures of the humerus. There are 3 general classifications, Doctor? Yes. Then the fractures of the shaft of the femur are subdivided into fractures of the upper, middle, and lower thirds of the shaft. Where are fractures, Doctor, of the neck of the femur located? Those are fractures occurring between the head of the femur and the base of the greater trochanter. What is the most common cause, Doctor, of such fractures? In most cases, a fall, although they are sometimes caused by direct violence, such as a blow. What types of fractures are usually found? Impacted and unimpacted fractures. The impacted fracture usually involves the greater trochanter, and the unimpacted fracture usually involves the head of the femur. It is also noted that the impacted fractures unite more readily than do the unimpacted fractures. Do fractures, Doctor, of the neck of the femur occur most frequently in any age group? Yes, most frequently in elderly people. The fracture may occur from slipping or falling from a standing position. Describe the symptoms, Doctor, of a fracture of the neck of the femur. If the patient is an elderly person, he is usually unable to rise from the ground. There is a pain present while the patient is lying still, and the pain increases upon movement. The patient is unable to move the limb easily, and upon manipulation there is a limitation of motion. There is frequently slight shortening of the limb at first, which may become increased to as much as 2 inches within 3 or 4 days if the fracture is not treated. If the fracture is impacted, crepitus is absent, but if the fracture is unimpacted, crepitus is present. Do these same symptoms, Doctor, present themselves in the case of a child? Not to as great a degree as in adults. A child may fall from a height and fracture the neck of the femur, and the fracture may be of the green stick type or impacted, and the child may continue to walk on the injured limb for a day or so with only slight lameness, but upon recovery will develop a permanent claudication. However, in other cases, the symptoms which are present in adults will appear in a child who has suffered a fracture of the neck of the femur. How is, Doctor, examination made to determine the existence of a fracture of the neck of the femur in adults and to further determine the type of fracture it may be? By X-ray history, location of the pain, palpation, the position assumed by the limb, and if necessary by manipulation to determine the presence of crepitus. However, in these cases it is well to keep the manipulation of the injured limb at a minimum. How are the fractures of the neck of the femur treated? By immobilization, usually with the limb in a position of abduction and extension, by means of a plaster cast which extends from the ribs or breast to the toes of the foot on the injured limb and to the knee of the uninjured limb. Are there other methods, Doctor, of treatment? Yes, in some cases where it is not advisable to give an anesthetic, the treatment may be by mild traction and partial immobilization. This is accomplished by applying traction straps to the leg and thigh and exerting traction through the use of weights and pulleys, such as the buck extension device. In other cases, a T-splint may be applied. This splint extends from the foot of the injured limb to the axilla or armpit and is fastened to the limb by means of straps and to the body by a swathe. Partial immobilization is obtained by the placing of sandbags around the limbs to immobilize it. Will you, Doctor, name some splints or other devices used in the treatment of these fractures? The Thomas and Hodgin traction splints, the Pearson accessory leg piece, the Sinclair footboard, and the Ransohoff tongues, sometimes referred to as ice tongues. What results may be expected from treatment of fractures of the neck, doctor, of the femur? The results vary a great deal. In very aged or feeble persons, the shock of the fracture is severe enough to endanger life, and the patient may die from shock within 2 or 3 days or within a week from hypostatic pneumonia. Or he may live several weeks and die of exhaustion caused by the pain and confinement. However, in most cases, if proper position and alignment are obtained and immobilization is accomplished, union should occur within 8 or 9 weeks. Continue, doctor, with your statement of the results of treatment. The results hoped for are only slight deformity, slight limitation of movement, and slight limp, with a fairly useful limb. It must be noted, however, that in some cases, chronic rheumatism will develop and prevent the use of the limb to any great extent. What may be done in cases of non-union, doctor? Who's 160.